Good morning, everyone. Welcome to another session of what we are offering here for Wesley Medical Center. I am Hope Helfrich. I am Student Placement Coordinator for Wesley Medical Center, and we are live in one of the emergency department rooms at Wesley Woodlawn. And today we have some really distinguishing.
Please don't extinguish us, Hope. We've done that one.
Distinguished healthcare providers. And I'm going to start over here on my side, over there. Randy Brenner, she is the manager of the main campus emergency department. Next to her is Dr. Francie Eckengren. She's chief of staff, and she is a physician that does all kinds of things, but today she's the emergency room physician.
Good morning.
And next to me is Travis Moore. He is the EMS coordinator for all of Wesley Healthcare, and he has a very vital role because of all of the transfers and transports that we get in. So we have your questions in front of us today, and we're going to answer as many of them as we possibly can, and hopefully have some additional questions at the end. The one thing I would ask is that your faculty, your instructors, have an evaluation tool, and we really need you to complete that at the end of today, turn it into your instructor, and then we'll get it back from the instructor. We use that feedback, those comments, to know where we can improve and maybe some of the next topics that we'll present. So without any further ado, there you go.
So we thought we might just start with Randy. It looks like Johanna and Victoria both asked, why did you decide to become a nurse?
Yeah, growing up, I am the oldest of 5 kids. I always was a caretaker. I wanted to help people. My grandparents had a lot of health problems, and watching the individuals who cared for them with such compassion and grace was something I knew that I wanted to do. I've been a nurse for almost 10 years now, and I found my home at Wesley's ER about 6.5 years ago. ER is just where my heart is. It's exciting. There's adrenaline. It can be boring, but it also is just very exciting. You get to help people who, of all different walks of life and paths of life, and it's wonderful.
So my name is Travis, as Hope said. I'm a paramedic and an RN at Wesley. The reason I became a nurse or a paramedic was real simple. I enjoy working under pressure, and I enjoy helping people. I am a bit of an adrenaline junkie, which we do have some of that. And like I said, I enjoy being able to help people when they're having a bad day. Hopefully I can be the one there to make it better.
So while I didn't become a nurse, I'm a physician, and I work with these guys, receive patients from Travis, and work side by side with Randy. Quite frankly, the ED is the only place for me. I, too, am an adrenaline junkie, but I also really love working with a team. And in the emergency department, we pretty much stay together. Other places in the hospital, the nurse may be at the bedside and the doctor kind of off-site or somewhere else in the hospital, but we get to pretty much stay together all day. And it's very exhilarating to have your team, and we approach patients. I really love kind of the puzzle that you have to put together when a patient presents, and the nurse has made an assessment, Travis has made an assessment, and I come in and we all work together to do team triage. And then the medical decision making is when you try to make a differential diagnosis of what are all the things this could be. So it's pretty exciting, and I've always felt like that was great. And I've been doing this for 30 years, so I must love it. We have a lot of questions about COVID, so we might just answer a few of those. Particularly, I'd like to be sure that all of you know that it's very safe to come into the emergency department during COVID. One of the things we've seen that's been really sad are people who have put off coming in and not been treated, say, even for appendicitis. And then when that appendix perforates or opens up, there's a lot more complications. And we've actually seen patients that have put off coming in. So I'd like to really say that we keep things very safe here. We all wear our PPE. We're keeping our masks on. We don't work here without masks. And so that's kind of out of respect for each other and for you if you come in with your family. Quite frankly, putting off coming in because there is a pandemic can almost backfire.
And I think, Jasmine asked that exact question, and I think lumping some of these together, it has been a very strange time since March of last year. We've seen a decrease in our patients coming in, resulting in sicker patients when we get them. But it's been a very stressful time for you guys. Remote learning's been crazy, but it's also been stressful for healthcare workers. We've had to adjust our staffing based off of the patients that we're seeing, which has gone down. Nurses are working harder to care for these very critical, complicated COVID patients. You've probably seen pictures of them in a lot of garb. They have to put that on every single time they go into that patient room. It's hot, and they're spending lots of time in that room taking care of those patients. So I've seen directly with my staff a lot of stress, but we've also seen how tough and how resilient our team is pulling through, because they do want to take the best care of our patients. I think EMS has had similar situations with this COVID stuff as well.
Absolutely. In the transport world, it certainly adds a lot of challenges for us. Early on, I think the biggest stress was just the unknown of everything. Really, we didn't know what was going on, what to expect, and even how to do our job somewhat. But there's a lot of extra stresses and all the PPE we have to wear. That includes in the ambulance, maybe in an aircraft, as well as the hospitals. When the weather is warm, that PPE gets hot and it's stressful. Your glasses start fogging up, things of that nature. So it adds a lot of stress to that as well in the transport world as well. Then also we have the decon process when we're down for an extended period while we decon our ambulances or our aircraft. So I would definitely say that it does add some stress to the transport world as well.
And one of the things Travis hit on for me, I intubate patients, and it's kind of tough when you have all that on, and now you've got your glasses, you've got a mask, it has to be positioned to keep from fogging, and then I've got a shield on, and you're looking into someone's airway, and everything's fogging up. So we had to learn to kind of deal with that.
Yeah, definitely you have to adapt and overcome with this.
One of the things that was asked also was what really maybe mentally was hard for you with COVID. And I think Madison asked that. I would tell you that for most of us, we were afraid we'd take this home to our families. So I signed up to put my, life on the line as a frontline worker. Don't always feel like a healthcare hero, even though we're called that. But honestly, it's the fear that you're going to take this disease home to your family, your little children. For some of you that have little kids, my husband, just that kind of weighed on a lot of our minds. Absolutely.
I think that was one of the biggest stresses for me, as I have kids at home and my wife as well, just being worried, like I said, so much of the unknown and worried about taking this home to them, and even not being able to see our parents or not getting elderly parents sick, things of that nature. So, yeah, a lot of that stress as well.
For sure. And I think, I saw directly with our staff, they had the same stressors as, they were bringing clothes to work to change in the locker room, to wear new clothes home, they would derobe in the garage and shower right away before they even hug their kids. I know I didn't see my grandparents for a few months at the beginning of this just because I was afraid, and they're both elderly, have some other situations going on that I didn't want to get them sick because I knew that it wouldn't be a good situation for them. But I think that all of that, like I said, I just do think it's amazing how we've all really kind of worked together to get through all this and figure out how to get through these stresses and overcome them. Even though it's crazy now, it's almost been a year. I just can't believe that, how much we've gone through this last year.
And one thing on the positive side, I like to be around people, and I kind of get regenerated that way. And we do get to come to work and hang out together. So even though we're in quarantine at home, we're not going out very much, and we're always in our masks, we get to see our buds at work, and it's kind of been a gift in a way.
I agree with that, because I think humor is a huge thing, at least for me, but also for some of our other team. Like we are very serious and very good in really high stress situations and situations where we need to be serious, but we survive off of that humor and off of that bond we have with each other, just joking around day to day when the EMS crews come in yelling hey at them. So it has been really nice to still have that social aspect while you're quarantining on the other side of things.
And Travis, I don't know if you're taught this in your training, but you guys have some of the worst jokes when you come in.
I think it seems to be a prerequisite that keeps getting passed down from the instructors to the medics, to the new medics, et cetera. She keeps getting passed down, and the same old bad jokes keep recirculating.
But it's fun. So we do have the opportunity to be friends and be at work, so that's been good. Yeah.
Is there ever an opportunity or a chance of having conflict between providers, nursing?
We're going to
fight. No, for me, I worked in a med surg setting my very first few years at a nursing school, and I was calling doctors or I didn't really know who the doctors were. I can tell you, since I've been at Wesley's ER, I know these physicians by name. I know most, sometimes about their families. They know me by my first name. And I think that when there is a disagreement, it is, I feel comfortable approaching them and telling them what my concern is. And if they don't agree with me, they tell me why. I think it's a mutual respect. They help me learn because we see each other taking care of patients in some of the worst imaginable situations, and we respect each other through that. So I think that there is going to be conflict, but it's the way you react and treat that conflict. You're there for the patient to do what's best for the patient. And I think as long as you remember that, you'll get through all of that.
I would say, I think conflict is even a strong word. I think there's sometimes a difference of opinions.
Yeah.
And like Francie said, that when the patient comes in, a lot of times we're trying to figure out a differential diagnosis. And so sometimes there's a difference of opinion as what's going on with the patient. And so that's when an opportunity to have a team discussion and work with each other. So I think conflict is probably a strong word
For sure.
that we don't necessarily see. It's just a difference of opinion more than anything sometimes.
I agree. And when EMS comes in and our team is awaiting their arrival with the patient, a lot of things are going through our heads, and they know the patient better than anyone at that point. So I want to just really tag on to what Randy said about respect. We respect each other. We all each have our niche in this whole treatment plan, but we respect each other. And so being a team, listening and communicating, the people I appreciate the most are the ones that will tell me what they're thinking, maybe even challenge me a little bit, because you can get kind of a tunnel vision, or we call it diagnostic anchoring, where you think this is what it is, and you really have to have the team come around you and help you with that. And that's true in most anything you do, but it can be life-saving for us to be a team. And so I really think that the conflict, once in a while, somebody will really get upset with what I'm saying, and we have to take it offline just a little bit. And I hear people say to the new nurses, no, it's okay, you can ask her, she won't yell at you. And I don't, but we really have to encourage that, because with that respect, we can take better care of patients. Sure.
So Eric, what keeps you motivated? What inspires you in these troubling times?
Oh, what inspires us in these troubling times? For me, it's just always going back to my why. I think in the midst of all of this, with this burnout, how hard it's been these last few months, I think it's easy to forget why we got into these fields. So I think that my why is just, I want to take care of people. I want to impact, even if it's just one person. I got guided into leadership, and now I get to watch these nurses and EMTs and paramedics grow in their role and provide the best care they can for these patients. I want to make somebody's worst day better, or be there to hold their hand through some imaginable events. And that's kind of, I just try to remind myself of that through all of this.
I think just standing here by these two, and we've been doing this for quite a long time, we have a pretty wicked skill set amongst the three of us. And I think bringing that to the table every day and to the patient's bedside, it really encourages me and makes me get through a lot of the stressful times. One of my partners just said to me the other day, I'm going to keep practicing for a while, because I have a really good skill set. And I thought, well, it is kind of a special skill set. So I want to use that, and I want to use it to help people. And all of us standing here, while we hate the moment when someone's really in trouble, that's probably when we kick in the best. And there's just, everybody's hands are on deck. In a code situation, when we're running a code, there's a pit boss that calls out the code. There's somebody who's doing compression. Nursing is getting lines and giving meds, and pharmacy's there. Our EMTs stand by. I am standing there ready to intubate. A lot of times I just stand at the end of the bed and watch everyone work and give some direction. So those are the best moments. They're pretty exciting, and it is pretty fabulous when you bring somebody back from the brink.
Yeah, absolutely. I think the thing that inspires me or motivates me the most is being around people like you guys, working with team members. I see there are so many wonderful people, super smart, very talented people that I work with. If I'm having a bad day, I tend to look towards people like you guys that help motivate me, and I see what you're doing, positive attitudes, and doing it with a smile, and that's what keeps me motivated when I'm having a bad day.
You can see the smile in our eyes. Right?
Absolutely. That was the mask. You can see the eyes light up.
Yes, you can.
So what kind of special training have you all had to provide the kind of care that you do?
Well, I started out as a paramedic, so I first went to EMT school and then paramedic school. Been a medic for almost 18 years, been a nurse now for about 8 years. So I went on to nursing school after that as well. I've had some advanced certifications. I worked as part-time as a flight medic, and so I've had some advanced certifications as well. Specialty classes, we do cardiac classes, pediatric classes, trauma classes, things of that nature. So quite a bit of additional training, but in addition to the paramedic and nursing school.
For me, it's med school, residency. That's somewhere between 3 to 11 years, depending on what you pick. Now, if you're going to be a neurosurgeon, you might be on deck for about 11 years learning how to get in the brain. They don't take quite that long to train us in emergency medicine, but it's a nice, long, very broad spectrum kind of residency program. And then we learn on the job, obviously. One of you asked, what's the first day like? I think JR did that. It's scary. It's scary the first day you're the attending making decisions, or it's your first day as a nurse, your first day as a paramedic. So don't think that we just are all bravado, but we are pretty well trained when we hit that floor. And then usually there's a lot of people with some tenure that help us and guide us. We have orientation programs that are strong. So on-the-job training, constantly. You're always a learner. You're always in that mode. And you guys do a lot to orient people and train them.
We do, and we even started a new program that we call EDGE in the emergency department, where it's a 16-week orientation program for our new grad RNs, where they do an 8-week simulation lab and then 8 weeks strictly on the floor. And I remember my first day off the floor. I've been a nurse for a few years, but I got to the ER and I was like, who let me do this? Like, how did I get here? But, you know, it's just not being afraid to ask questions. Knowing that you're there to learn something new every day. I went to nursing school for 4 years, and I've been learning ever since. I haven't stopped. You get all types of certifications on the job, and literally just learning every single shift. And if there's one thing I can tell you, it's do not ever be afraid to ask questions that can save lives, like Francie said.
Were you always good at comforting people, or did you learn with time on the job? That was from Roberto.
Well, Rebekah, I think it's something, a skill that I've certainly gotten better at over the years. Just like everybody else, we have good days and bad days, and so sometimes it's harder to be that comforting person, but it's something that you learn, I think, on the job as well, understanding that they're having a bad day, maybe a bad moment, and so we need to be there to try to comfort them the best we can, and it's something that we certainly have to work on, a skill that we certainly have to work on.
I have kind of a strange background. I grew up in a funeral home. My family owned a funeral home. And so many times I was the person who after hours would let a family in to see their loved one that was deceased. And it was a very big education in how sad people can be and how much you do need to stop, sit down, and just open yourself up to people. So I kind of got that training. I also decided I wanted to be trying to save a life if I was going to be up at 2 and 3 in the morning. So it just really is, I don't know, I think you're right. You learn to kind of put yourself out there and just think about what would I want if this were my mom or my dad or my child? How could I help other people?
I don't know, I just grew up wanting to care for people. I'm a very empathetic person by nature, which can be hard in this kind of setting. It's learning kind of how to compartmentalize it and just finding the joy in the day-to-day and having a good support system outside of this kind of stressful environment.
All right, shall we see if the students have any questions?
Oh, yeah. We want to see if you guys have any questions for us there at home. I hope you're all bundled up and warm.
Andrea said, I have a student that is interested in if and how they are involved in follow-up to ER visits. So are you guys involved in any follow-up to ER visits?
We have different programs. Follow-up to ER visits. Well, anything that you have done with like a lab or a test that needs to be repeated back to you or called to you in a day or two, we have very strict mechanisms for getting that information back. We also have at times a callback program where we just call and check on people. And I have to tell you, there are a lot of us that if we've seen somebody that we just kind of worried about, we just make those phone calls. So we've had formalized programs. Right now, I don't think we're doing that as intently, but we follow up on all our lab work and cultures if those need to be communicated to a patient.
For the trauma department, I know they have the trauma clinic, so for trauma patients that are dismissed, they will come in maybe a week or two later, and they'll be reevaluated and helped in any way needed.
Yep. And we do refer anybody that has a special illness or disease or injury to the specialist. So we have that kind of follow-up. So if you come in and your arm is broken, frequently the ortho residents are coming down with us to get you back in alignment and get you in a splint. I handle keeping you comfortable and maybe sleepy through it. And then we make sure you have a follow-up at a clinic and with an orthopedic specialist. So that goes on with most patients. For sure, for sure.
Could I ask you guys a question? Can you hear me?
Yeah.
Okay. I'm looking that you are in one of the rooms in the emergency room. Could you possibly show them maybe some of the equipment that is most used? You know, maybe if there's a crash cart or anything there that you might just show them what a typical room looks like?
Yeah, I think, like they said earlier, I work at the main campus, so all of the rooms, though, in our ERs are set up somewhat similar, so we know where our life-saving equipment is when we need it. This is a crash cart. This is what we use in very, very critical situations, most often when we're coding a patient, and we need to get stuff that we need very quickly. So this is the monitor that we'd hook up to the patient. It would, we hook up the leads to the patient's chest, and it's going to tell us what the rhythm is that the patient is in. At that point in time, Dr. Eckengren would assess what the patient's rhythm is and decide if we need to shock the patient, which this device does as well. You hook it up, the pads to the patient, and then we would set the system up to shock the patient to hopefully get their heart restarted into a correct rhythm. What else do we got here?
We have an ambu bag over here. We can talk about this.
Sure, this is,
livelihood.
yeah, this is what we call an ambu bag or a bag valve mask. This is what we use to ventilate a patient. One of the things that we talked about, Grant talked about, is intubating patients. This can be used before or after they're intubated, but this is what we help use to ventilate them and inflate their lungs, make sure that they're getting the oxygen that they need.
As you can see, all the drawers on the cart are labeled, so we easily can get to what we need. So you're going to have all your IV supplies, the life-saving meds that we're going to push into the patient, which can also help reset rhythms or help correct imbalances that might be affecting their cardiac function or their breathing, whatever it may be.
And when you see this on the cart, that means it's all been checked. Everything is in the exact place it's supposed to be. That's our lock to tell us no one's been in this cart. This one's ready to use.
What else do we have? The cart behind Dr. Eckengren here is a Braslow cart. This is a specific cart for pediatric patients. It measures them by height and their weight and bases the biggest thing is it doses their medications based off of that weight that's given, which is how we treat pediatric patients.
So that tape just gets stretched out on the bed beside the child, and you go right to your colors. If the child reaches to blue, that's blue. Everything you want to get out is in this blue drawer. And then we make decisions about what size the ET tube, the endotracheal tube is that we intubate, and what size of a blade that we use to, and it's just a little guy. It's got a little bit of a metal, we call it a blade, but it's not sharp. And you just lift, look, and kind of put your tube in if all things go well.
And over there by Travis is a ventilator. When you, after the physician has placed the EP tube, respiratory therapy, which is another one of our teammates, will hook the patient up to this to breathe for the patient.
Basically, this is the mechanical version of the bag that I showed you. So this just takes over ventilation for them, helps us do it in very specific parameters.
This is what's used on COVID patients.
Absolutely, and that's one of the questions was this is what used on COVID patients, and this is what they talk about when they talk about COVID patients being on a ventilator. So this is the machine or something similar to this is what we use.
Then that big old machine back there is an infant warmer. Believe it or not, we do and have delivered babies in the emergency room. It's not my favorite task, but it is amazing. We get to see the array of different things you get to see in the emergency department is so crazy. I don't think there's anybody that can fight and do it like we do. You have to have every single skill set in the ER. So I think that's all the big wigs in this room. What else we got here?
Well, just the standard one. Yeah, everybody that comes in this room. This is kind of our bigger room if somebody's extremely sick and or trauma. So that's one of the reasons we kind of keep this room available. Lots of room to move around. As you can imagine, there's a big team in here when something like that's happening, a code or a trauma. And you could have 8 people in here working. So it's pretty busy at times.
For sure. And I think that's what's so neat about the ER too is we work with so many different types of people. We work with EMTs, paramedics, respiratory therapists, the trauma team. We have X-ray, radiology, all sorts of different skill sets. We even work very closely with the chaplain group in our hospital to help provide that resource and comforting person for patients and families, especially right now when we're limiting the amount of people that can be in the room with our patient. We were doing no visitors at once, but we know how important it is for loved ones to be with their family. So it's just really cool. So many different ways to get involved in the medical field. Any follow-up questions at all?
I had one follow-up question, and I'm having a hard time finding the chat, but one follow-up question one of my students had was, what happened if you have a manic patient or a patient out of control that comes into the ER? How do you handle that?
So from the pre-hospital setting to our setting, we have learned de-escalation techniques. The best thing we can do for a patient who has any kind of mental illness or just is in a post-traumatic stress situation is help settle them down. We'll take them to a quieter room. We'll get the lights a little dimmer. If they are out of control and are aggressive and are, somebody we just can't control very well, we do bring the team around. Sometimes our security folks are with us. We make sure the patient is safely placed on the bed. Occasionally we have to use restraints. We try not to do that because it's really hard to have restraints on if you are the patient. And then, of course, we have certain medications that we can give to actually just calm the patient down. And we do that if we need to. But de-escalation and coming alongside the patient is our first step.
Another one from Northeast. How do you deal with high traffic times? Do procedures change?
So we've done a lot recently around what we would call surge capacity. That's when our, not only is our hospital full, we're using all of the beds in our hospital, but our emergency room is also crazy busy, and we have 20 plus patients waiting in our triage area. We've learned a lot from this over the last few years. Every department in the hospital has a different procedure, so procedures do change. Our physicians get involved on the inpatient side and decide what patients can safely go home to open more beds. We talk very actively with our EMS crews about how can we place all these patients throughout the different hospitals in the Wichita market to get our most critical patients seen and cared for first. And then it's just our nurses are well trained on triaging those patients on who can wait safely and who needs to come back right away.
Can you actually admit a patient from the ED into the hospital, or is that what process is that like?
No, absolutely. That's pretty much what the whole situation is about. When a patient comes in, we make the decision whether they need to stay in the hospital or they can go home. And, the predominance of our patients do go home, but quite a few get admitted. In fact, probably about 22% of the people who come through the ED end up in admission. And so I then call the hospitalist who's receiving patients or a specialist or both a lot of times and make a plan for the patient to be admitted, where they'll be admitted. So by the time I make that call, I pretty much need to know what's wrong with the patient. And I've done lab, imaging. I've also taken a good history. We've had time as a team to talk to the patient and see what's unfolding. And then I make the call to another physician to get the patient admitted to the hospital. So a big part of our job on sicker patients is definitely admitting them to the hospital.
You all work under pressure and work well under pressure. But what do you do outside of the job that really keeps your cup full? What is it that gives you solace and peace when you walk away?
So what do we do outside of work that helps us survive in this high-pressure environment? For me, it's my family and friends. I'm very close to my family. My husband and I live close to his family, too, and he's close to his family. So it's just honestly spending time with him and our extended family, but then also just having some of that alone time. I love to read, and I love to watch sports. So I think it's different for everybody.
Sure, I have a couple hobbies. I like to work out. I like to ride my motorcycle.
Mm-hmm.
I've been a youth sports coach for over 20 years, and that's probably my biggest thing is I get out and hang out with the kids and have a lot of fun doing that.
Yeah.
So that's my biggest thing.
Yeah, for me, I'd say still what you're both saying, kind of family, friends. I'm a runner. I've run a couple of marathons, quite a few half marathons. Running just really kind of sets me free.
Mm-hmm.
And right now I'm running on a treadmill, so I watch a lot of TV while I'm running. I've been watching Schitt's Creek.
Oh, yeah.
So just lots of fun stuff that, takes your mind off of it. And I think, eating well, definitely getting sleep. We don't talk about that much because we have a lot of interrupted sleep with the kind of shifts we work. But you really have to have that downtime, and sleep hygiene is very important. So you've got to get your hours in. And I think I do stay a little bit mindful about that.
Yeah.
How long typically are your shifts? Does it vary?
So for nurse, I can speak to the nurses' shifts. For the most part, the ER is pretty unique where all throughout the hospital, we work 12-hour shifts, basically. They do like a 7A and then a 7P start. In the ER, we have to kind of base our shifts based off when our patients are coming in. So we have 12-hour shifts and 10-hour shifts that spread between morning shifts, afternoon shifts, and night shifts. So that's pretty unique.
From an EMS standpoint, I've worked both 12 and 24-hour shifts.
Mm-hmm.
I actually like doing 24-hour shifts. With that, I was doing 2 days a week, and so I would have the other 5 days off. Sometimes you would get some sleep, and sometimes you wouldn't, so you would spend your days off sleeping. Now, as in my current position, I don't have a set schedule, so to speak, so it's typically 8 to 10 hours a day.
Yeah. So for the ED docs here at Wesley, we have a lot of 9-hour shifts, and we try to build overlap in, because one of the places you can make your biggest mistake is in a handoff in patient care. So we try to make sure we have a little overlap with our providers to make good discussions and good handoffs. But a lot of folks like 12s, and in your age group, I see folks who do like 12s. 24 is a little too much in an ED that's busy, in my opinion. For sure. But I know that a lot of folks like the 12s because you can do 4 and be off for 4. And that's a nice way to have your life if you still are going to school, because a lot of our nurses are pursuing higher advanced degrees. So honestly, you can really make the schedule what you want it to be, I think particularly in the emergency department.
How did you get to where you are? What kind of pre-schooling did you do? What kind of programs made you select this particular endeavor? What does it take to become you?
Yeah. How did we get to where we are? I think for me, oddly, I thought I knew ER was where I wanted to be, but originally I thought I wanted to be an advanced practice nurse practitioner. And then I got in the ER, and I was like, that is not for me. So I found my way. I decided I liked to lead the team. So I became a charge nurse, and then kind of grew in that role for a few years, and then was able to become the manager, which I've been in for just over a year and a half now. So I thought I knew what I was going to do, and then it completely changed while I was here at work. And, doing this job, like Dr. Engberg mentioned, we still get to go back to school. So I am taking master's classes to get my master's degree in nursing leadership. So there's so many opportunities and different pathways that you can take.
I really like the hospital setting because there are so many things you can do within Wesley Medical Center. I finished my residency here, started in the ED many years ago, and I developed a wound care unit at the hospital that my company provides the doctors and mid-levels for that. And I was the chief medical officer of the hospital for 20 years, which is a big, big administrative job. So what a great opportunity to do different things, to go into leadership and to take your, a lot of us get elevated because we're really good at what we do as clinicians, as doctors, nurses, and paramedics. And then you just kind of have that leadership piece that you want to use. You can't shut it down. So I think that's why a lot of us get into leadership in these.
For me, as the EMS coordinator, it was important that I have experience with both the transport and the hospital side of things. So my background in EMS as well as nursing made it a unique combination that I was able to have knowledge of both sides of it and basically be the liaison between the EMS and the hospital.
Melody says that Daisy Mahara Zavala, I think, works in Wesley ER, graduated from West High Health Academy where she got her EMT certification.
Really? Yeah, no, Daisy's one of our, she's an exceptional nurse. She worked with me on night shift when I was a first charge nurse. She is a go-getter, caring spirit. She fits right in with our team. You know, we love people who are there, boots on the ground, ready to go, not afraid to jump into any situation. She's grown into a preceptor. She trains some of our nurses in the triage area. She's really involved in the education of our nurses, so she helps teach our trauma nurse certification course. So that's one way that she gets involved as a nurse, still working her 12-hour shifts. She helps make our schedule, so she makes the schedule for 80, 85, 90 nurses, so it's really cool. Yeah, go Daisy. I'll tell her you gave her a shout out.
I'm getting to see my kids' friends from East High that are working in RED now. One of our newest nurses was my daughter's friend's little sister. So it's like, hey, Noelle, good to see you. So just kind of cool to be part of the Wichita family and community and work at Wesley Medical Center. You would really love that part of our teamwork and our job, just because, you know, coming from the high schools that you're in, you're part of the community already. And that really resonates with people. You'll see folks, you know, and we always have to be careful because we have this HIPAA rule where we can never talk about patients and what's going on with them outside of our care team. And so that's something we are always mindful of. But it is very interesting to see folks, you know, in our hospital in the ED, for sure.
Are there any more questions that you guys can think of at the moment?
Not for my students. We're okay.
Anything from Andrea's class?
I think you have answered as well. What I'm getting from my students is big thank yous for taking the time to talk to us.
Absolutely. It was our pleasure.
Yes, thank you from West High School. We so appreciate it because these kids are, their senior year, going to be doing the CNA and EMT and phlebotomy and EKG classes. So this helps them make that decision on what classes that they're taking as seniors.
I think that's really awesome. And I started as a CNA, so I think that gives you a great baseline and appreciation for how it takes a team to work in a hospital and ER setting. Thank you for being here with us today, guys.
We need your help. Come to Wesley. Thanks for listening to us.
Absolutely. As far as EMS specific questions, if you guys have anything EMS specific, reach out to Scott. I'm sure he can get you my contact information, and I'd be happy to visit with anybody further or answer any questions we can from an EMS standpoint.
And I think you guys are absolutely on the right track.
Thank you so much.
Because you are in programs and organizational kinds of leadership within your own school, and that's going to lead you to making wise choices when it comes to your career, whether it's healthcare or something else. We just need everybody to be on the same team and play together. So what I like to do is ask everyone again to do the evaluation and turn that into your instructor so that we can get that back and we can get feedback and know where we need to go for the next session. So thank you very much.
Hope you did email that again to me, did you not? Or
we'll get it to you,
you
Melody. Sure.
Yeah, just email it to me.
Absolutely. When I get back to the office.
Thank you. Thank you. Bye, guys.
Thank you.